Good morning, this is Jason Latello, the Behavioral Health Coordinator for Denver Public Health. Last week we discussed the fact that many men only receive behavioral health treatment after the commission of a substance use related or a violent crime. This week we're going to talk about male socialization as a primary contributing factor to why men typically do not engage in help-seeking behavior before they get in trouble. From an early age, boys are taught to man up in the face of adversity. Many of them are told to stop crying before they are given something to cry about. As a result, boys and men don't really learn emotional fluency. They don't learn how to experience, let alone express, uncomfortable emotions in a healthy fashion. Instead, they learn how to distract from or suppress them until they no longer can. Oftentimes, this results in these uncomfortable feelings coming up in ways that are harmful to themselves and to others. And then you have the man rules, which Dan Griffin talks about, and you can check out his site, Griffin Recovery Enterprises, for more information below. But what are these man rules? And we all know them. Don't ask for help. Don't be vulnerable. Don't admit that you have a problem. Don't be weak. Don't cry. Don't share your emotions. And then you have the rules of successful treatment and recovery. And what are those? Ask for help. Admit that you have a problem. Cry. Share your emotions. Be vulnerable. And then you have the rules of successful relationships, such as communicate. Be vulnerable. Share your feelings. Compromise. Don't take control. And on and on. So we have all these rules that are in direct contradiction to the rules that we internalize as men, which keep us safe. That's what the man rules are about. Safety from violence, from trauma, from victimization, and frankly from each other. The man rules put distance down between a man and anything perceived as less than manly, which really perpetuates homophobia and misogyny even further. I do want to note that there are many positive values associated with so-called traditional masculinity, such as courage and strength and justice. What I'm discussing is not masculinity itself, but what many refer to as toxic masculinity, or whatever you call it. The fact is that the way many men are raised and socialized is a primary contributing factor to a lot of the poor mental health amongst men that we are seeing, and their symptoms such as substance use, violence, suicide, and over-incarceration. Next week, we're going to discuss how all of these are societal problems, which in turn require a societal response. Thank you for joining, and tune in next week.